What if everything you thought you knew about, well, a common biological process was only half the story? Today, we're taking a deep dive into the fascinating world of ketosis. You might hear that word and think, okay, simple concept, right? But our sources today reveal just how wildly different ketosis can actually be across species. We're going to explore it as, a devastating disease in some cases, a remarkable evolutionary adaptation in others, and even a metabolic state that's completely avoided.
That's absolutely the challenge we're tackling. For this deep dive, we're going to immerse ourselves in the metabolic narratives of three very different animals. We've got the high-production dairy cow, the dromedary camel, and the white-tailed deer. Each one really offers a unique perspective on how it manages energy when food is scarce and what precise role ketosis plays. Our mission, essentially, is to truly understand the profound why behind these, well, pretty striking differences.
Okay, so let's begin our journey into this metabolic puzzle. We'll start with an animal many of us might find familiar, but whose struggle with ketosis is anything but natural: the high-performance dairy cow. This animal is, unfortunately, kind of the poster child for pathological ketosis. And what's truly striking here, as you pointed out, is that for dairy cows, ketosis isn't some inherent biological vulnerability. It's what we call an iatrogenic consequence,
Right.
meaning it's a condition directly brought on by us, by human intervention, specifically our artificial selection for just extreme milk production.
Exactly. At its core, bovine ketosis is the clinical expression of severe negative energy balance, or NEB. This is simply where a cow's energy demands drastically outstrip its energy intake. For dairy cows, the main trigger for this severe NEB is the immense demand of early lactation, especially in those first, say, 6 to 8 weeks after calving. We've basically bred these animals to produce an extraordinary amount of milk, pushing their systems right to the brink. We've inadvertently created a metabolic demand that can just overwhelm them.
Wow, so it's a side effect of breeding for production.
Pretty much. And the striking insight here is how many seemingly minor factors can tip this really delicate balance. Cows that are carrying too much body fat at calving, for instance, they're particularly susceptible because they mobilize fat way too excessively, too rapidly, trying to meet that milk demand. Also, anything that reduces their feed intake, like, not enough space at the feed bunk, inconsistent feed delivery, or even other illnesses happen at the same time, like mastitis or lameness, that can suddenly overload a system that's already running at maximum capacity, making them really susceptible to this metabolic crash.
Okay, so when a cow hits this energy wall, how does its body respond? What's the sort of internal cascade that leads to ketosis?
Well, first, blood sugar drops. That's what we call hypoglycemia. In a desperate attempt to find fuel, the body starts breaking down its fat reserves. That process is called lipolysis. And this just floods the bloodstream with a huge surge of free fatty acids, or NEFAs.
Right, the fat breakdown products.
Exactly. And this is where the liver, the body's central processing plant comes in. It tries its best to use these free fatty acids for energy, but in a cow experiencing severe NEB, the fat mobilization can be so rapid and massive, it just overwhelms the liver's ability to process them completely.
So it's like a bottleneck.
Precisely. So the excess fatty acid components get shunted into an alternative pathway, ketogenesis. This creates what we call ketone bodies. They're essentially alternative fuel packets. Pyrrolhydroxybutyric acid, or PGA, makes up the bulk of them, something like 70%, alongside acetoacetic acid and acetone. What's interesting for cattle specifically, though, is that even severe hyperketonemia, high levels of ketones, usually doesn't lead to the metabolic acidemia, that dangerous drop in blood pH that you might actually see in other species.
That is interesting. Is it always the same kind of ketosis?
Well, veterinarians often categorize bovine ketosis into two main types. There's type I, or primary ketosis, that typically appears maybe 3 to 6 weeks post-calving, near peak milk production, and it's often linked just to straightforward underfeeding, not enough energy coming in. Then there's type 2 ketosis. This happens much earlier, like right after calving. And it's associated with that excessive fat mobilization in cows that were overconditioned, too fat at calving. This type 2, frequently comes hand in hand with a fatty liver too.
Okay, so if you're looking at a cow with clinical ketosis, what signs are you actually going to see? What does it look like?
Well, you'd observe a noticeable drop-off in appetite, but specifically, they often prefer forage, like hay, over their grain concentrates. It's a specific type of anorexia. There's also usually a pretty rapid drop in milk production and significant body condition loss. You can see them losing weight quickly. And a very distinctive sign, almost pathognomonic, is a sweet acetone-like smell on their breath or in their urine.
Ah, the classic smell.
Yeah, exactly. And in a minority of severe cases, maybe 5–10%, you can even see what's called nervous ketosis. That's where cows show really abnormal behaviors, licking or chewing obsessively, incoordination, sometimes aggression, or even bellowing loudly.
That sounds pretty dramatic, but you mentioned most cases aren't like that.
That's the really profound aspect here. The vast majority of cases, perhaps 80–90%, are subclinical, SCK. This means ketone levels are elevated, definitely above the threshold, but there are no obvious outward signs of illness. The cow looks normal.
So it's silent, but potentially still causing problems.
Huge problems. Despite being silent, subclinical ketosis is immensely important economically. It acts as a gateway disease. It significantly increases the risk for other major postpartum diseases like displaced abomasum, metritis, that's a uterine infection, and mastitis, udder infection. It creates this truly vicious, self-perpetuating cycle. Inflammation from an infection can actually worsen the NEB and trigger ketosis, and conversely, the high ketones, the hyperketonemia itself, can impair immune function.
Making the cow more susceptible.
It's exactly. More susceptible to those secondary diseases. It's a downward spiral.
Wow. So how do you catch this subclinical form then, if there are no signs?
Yeah, that's the challenge. For diagnosis, especially for SCK, direct measurement is absolutely crucial. The gold standard is measuring BA in a blood sample using a handheld meter. Right there, cow side. A concentration of 1.2 millimoles per liter is generally the diagnostic threshold. There are also less precise but convenient options like dipstick tests for ketones in urine or milk. They're useful for screening.
Okay, so with this understanding of the problem, the disease, what's the main goal when we intervene? What are we trying to achieve?
The goal is always twofold. Reestablish normal glucose levels in the blood and reduce those circulating ketones, get the energy balance back on track. The standard treatment is giving oral propylene glycol. It acts as a glucose precursor, something the liver can easily turn into glucose. For acute cases, especially if you see those neurological signs, an intravenous bolus of 50% dextrose can provide immediate glucose. But the effect is often pretty transient. It doesn't last long.
So treatment helps, but it sounds like prevention is key.
Prevention is absolutely paramount. It really focuses on optimizing nutrition and management for what we call the transition cow, that critical period from about 3 weeks before calving to 3 weeks after. This means managing their body condition score in late lactation so they aren't overly fat when they calve, maximizing their dry matter intake, getting them to eat as much as possible, and mitigating stressors.
Stressors like?
Things like overcrowding, heat stress, social changes, anything that might make them eat less. There are also some feed additives that can help fine-tune their metabolism, things like niacin, certain yeast products, and rumen-protected choline. These can support liver function and energy metabolism.
Okay, so we've just seen how basically human ambition can push an animal's metabolism right to its breaking point, a production disease. But what if there's an animal that, despite facing extreme scarcity, has actually evolved to almost entirely avoid ketosis? Let's turn our attention now to the dromedary camel, a true marvel of metabolic resilience. Even with prolonged fasting and dehydration, conditions that would severely impact other ruminants, camels maintain remarkable internal stability. This is often called the Camelid paradox.
That truly is a paradox, especially when you contrast it directly with the dairy cow we just discussed. The camel's metabolic strategy, well, it starts with its unique digestive anatomy. They're classified as pseudo-ruminants. This means they have a 3-chambered stomach, C1, C2, C3. Functionally similar, yes, but structurally distinct from the 4-chambered stomach of true ruminants like cows or deer.
How does that difference help them?
This anatomy, combined with a significantly longer retention time for solid food particles and a more potent population of fiber-digesting microbes, allows them to extract nutrients exceptionally well from really low-quality, high-fiber desert forage, stuff other animals couldn't survive on. On top of that, their maintenance energy requirements are estimated to be only about 2/3 of beef cattle of a similar size. They're just more efficient.
Yeah.
And they maintain a remarkably stable stomach pH, which is key for keeping those microbes happy and working.
That's incredible efficiency. But what truly makes this fascinating is how camels manage their blood glucose during fasting. You mentioned they somehow maintain consistently high and stable blood glucose levels through sustained gluconeogenesis, the liver making new glucose. How do they pull that off when other animals would crash?
It's coupled with exceptionally tight regulation of fat metabolism. That's the key difference. While fasting does induce some breakdown of fat in camels, sure, the resulting increase in free fatty acids in their bloodstream is markedly lower than the massive surge you see in other fasting ruminants, like that dairy cow.
Ah, so they don't flood the system.
Exactly. This prevents the liver from being overwhelmed in the first place. Even after 5 days of complete food withdrawal, studies show their ketone body levels remain astonishingly low. This demonstrates a unique, evolved capacity to precisely control both fat breakdown, lipolysis, and glucose production, gluconeogenesis rates, actively preventing a ketogenic state from ever really taking hold.
And you mentioned something about urea recycling. How does that fit in?
Yes, that's another crucial piece of their metabolic magic. Efficient urea recycling. During times of starvation or low protein intake, camels can salvage urea, a waste product in most mammals, from the blood and secrete it back into the forestomach, the C1. This provides a vital nitrogen source for their gut microbes to synthesize new protein, effectively preserving lean body mass. It's a powerful protein-sparing mechanism that helps keep their muscles intact even when food is incredibly scarce.
Okay, so what's the fundamental biological reason for this remarkable resistance to ketosis? Is there some kind of inherent metabolic throttle built in?
That really is the core of it. Research has revealed something quite fascinating. Camels have very low levels of a specific enzyme called beta-hydroxybutyrate dehydrogenase, or BHBDH. They have low levels in both their liver and their rumen epithelium. And this enzyme is absolutely key for synthesizing ketone bodies, particularly BHBA.
So they physically can't make many ketones.
Effectively, yes. This low enzyme level acts as a permanent throttle on the ketogenic pathway. It just prevents high ketone production from ever happening. It reflects an evolutionary philosophy, if you will, of profound conservation and risk aversion, actively avoiding the physiological extremes of deep hypoglycemia and hyperketonemia. And this is why clinical ketosis has, in fact, never been reliably reported in dromedary camels. It just doesn't seem to happen.
That's incredible. Truly a different metabolic world. So if a camel is showing signs of illness, maybe it's off feed, lethargic, it's almost certainly not ketosis. That leads us to ask, what are the important differential diagnoses then? What else should vets be looking for?
Exactly. And this highlights the absolute necessity of a species-specific approach to diagnosis. You can't just apply cow knowledge here. For example, pica, that's eating abnormal items like wood, plastic, or dirt, in cattle can sometimes signal nervous ketosis. But in camels, pica is almost exclusively a sign of specific dietary and mineral deficiencies. Things like phosphorus, calcium, cobalt, copper, or sodium deficiency are much more likely culprits.
So the same sign means something totally different.
Right. It's what we sometimes call a false cognate in medicine. The same clinical sign points to fundamentally different underlying diseases in different species. Other potential concerns in sick camels include metabolic acidosis, which can happen if they're suddenly fed too much grain or concentrates, and very specific mineral imbalances like hypomagnesic tetany, low magnesium, or fibrous osteodystrophy, a calcium-phosphorus imbalance affecting bones. Ketosis is just way down the list, if it's even on it.
Okay, so we've gone from the cow's human-induced crisis through the camel's evolved metabolic avoidance. Let's now transition to a completely different story. Our third animal, the deer. For deer, ketosis seems to be neither a pathological disease like in the cow, nor a metabolically avoided state like in the camel. Instead, it appears to be a natural and even essential part of their survival strategy, especially in predictable seasonal austerity, like winter.
That's a great way to put it. Deer are true ruminants, like cows, but their physiology is inextricably linked to the seasons, primarily governed by photoperiod day length. In autumn, triggered by those shortening days, they undergo hyperphagia. They eat voraciously, actively building substantial body fat reserves. For white-tailed deer, for example, body fat can increase dramatically, maybe from around 9% in September up to nearly 25% by December. This fat accumulation is absolutely critical for them to survive the winter.
So after packing on the pounds in autumn, what happens when winter truly hits? Do deer simply try to find less food, or is there a deeper physiological shift that kicks in, like hibernation, but not quite?
Exactly, it's not hibernation, but there's a profound physiological downregulation. As winter arrives, deer voluntarily restrict their food intake, even if food is available. And their metabolic rate can decrease significantly, by up to 50% in some studies. This is a crucial pre-programmed energy conservation strategy. It's designed to minimize expenditure when food is naturally scarce and often of low nutritional quality.
Okay, so they slow everything down.
Right, and the profound aspect here is that winter is, for deer, a predictable state of negative energy balance. They expect to use their reserves. Their survival depends entirely on mobilizing those accumulated fat reserves they built up in the fall, and this naturally, inevitably leads to ketone body production. This physiological ketosis isn't a disease state for them. It's an essential adaptive fuel source.
Fuel for what?
Fuel for tissues, importantly including the brain, when glucose derived from food is limited. Studies show that significant ketone accumulation typically occurs only in late winter, as fat reserves dwindle, indicating it's a controlled process, not an out-of-control crisis like in the cow. It's part of the plan.
But it can become pathological.
Yes, this adaptation only becomes pathological at the very end point of starvation. When those carefully stored fat reserves are completely exhausted, the body has no choice but to turn to protein catabolism.
Breaking down muscle.
Exactly, breaking down muscle tissue for energy. This final, desperate stage is characterized by uncontrolled ketosis, muscle wasting, and ultimately hypoglycemic shock, as there just isn't enough glucose or ketones left to maintain vital functions, especially brain function. That's when they succumb.
So, for wildlife managers, if they find a deer carcass out in the woods, especially late winter, how do they definitively know if it died from the starvation endpoint versus, say, something else?
That's a key question in wildlife pathology. For a post-mortem diagnosis of starvation, managers look for several signs. Severe emaciation, obviously, obvious muscle atrophy, particularly over the back and hips, and a complete absence of subcutaneous and visceral fat, no fat under the skin, around the organs. The really key indicator is something called serous atrophy of fat.
Serous atrophy, what's that look like?
Normally, the remaining fat depots, like those around the heart, coronary groove, and kidneys, are solid and white or yellowish white. In serous atrophy, this fat becomes reddish, gelatinous, almost like jelly, and translucent. It indicates the body has mobilized even these last vital fat reserves.
Okay, that sounds pretty definitive.
It is, but the gold standard really for diagnosing starvation in wild ruminants is analyzing the bone marrow fat content. In a healthy deer, the marrow in the center of long bones, like the femur, is solid, waxy, and white, packed with fat. In a starved deer, as that fat is depleted and replaced by water, the marrow becomes red-yellow, gelatinous, and glistening. Finding gelatinous marrow, regardless of the color, is considered a definitive indicator of advanced starvation.
Can you test for the ketones themselves?
You can. Biochemical analysis of VHBA in fluids collected post-mortem, like the aqueous humor from the eye or cerebrospinal fluid, can also confirm ketoacidosis. For example, in sheep that died from pregnancy toxemia, a similar condition, levels over 2.5 millimol are generally considered consistent with the diagnosis. Similar thresholds likely apply to deer.
That's such an important distinction to be able to make. What else could potentially mimic starvation in deer, something that might confuse the picture?
Yes, there's a critical differential diagnosis, capture myopathy. It's also sometimes called exertional rhabdomyolysis.
Capture myopathy. That sounds stress-related.
It is. It's an acute metabolic disease, but it's triggered by extreme physical exertion and stress, typically associated with capture efforts or maybe intense predator pursuit. It is not caused by negative energy balance or starvation.
So what's happening metabolically there?
Instead of NAB, it results from prolonged, intense muscle exertion that forces a shift to anaerobic metabolism because oxygen supply can't keep up. This leads to a massive buildup of lactic acid, causing severe metabolic acidosis. It also causes direct muscle damage, rhabdomyolysis, and often leads to acute kidney failure because the damaged muscle proteins clog the kidneys.
How would that look different post-mortem?
Post-mortem, deer that died from capture myopathy will show characteristic pale, damaged, sometimes swollen areas in their skeletal muscles and often the heart muscle too. This is a finding completely absent in simple starvation cases where the muscles are just wasted, not acutely damaged.
And why is this distinction so crucial for wildlife managers?
It's absolutely paramount because misidentifying the cause of death can lead to completely flawed management decisions. If deaths are attributed to starvation, the logical response might be habitat improvement, supplemental feeding, or maybe reducing the herd size to match the carrying capacity. But if the true cause is capture myopathy, perhaps resulting from increased human activity disturbance or even capture techniques themselves, then the appropriate response would be completely different, focusing on mitigating those acute stressors, changing handling protocols, or managing human access. Getting the diagnosis right informs the right action.
Fascinating. Okay, let's try to bring this all together. We've explored 3 vastly different narratives of ketosis: the cow, the camel, the deer. How do their digestive systems, their strategies for energy management, and their evolutionary histories really converge to create these distinct metabolic outcomes?
It's a great synthesis question. If we briefly compare their digestive systems again, the dairy cow is a true ruminant, inherently efficient, but often pushed way beyond its natural limits by our artificial selection for production. The camel is a pseudoruminant. Its three-chambered stomach is exquisitely optimized for maximal efficiency in really resource-poor settings. Longer retention time, potent fiber-digesting microbes, lower basal metabolic rate. It's a true model of conservation. The deer is also a true ruminant, but it's more of a concentrate selector by nature, adapted for browsing higher quality foods when available. And its digestive tract even undergoes seasonal changes in morphology, giving it flexibility to adapt to varying forage quality throughout the year.
Okay, so different hardware adapted for different lifestyles. And that leads to these different philosophies of energy management and risk we've discussed: the overflow, the conservation, the adaptation.
Exactly. For the dairy cow, we clearly see the pathological overflow model. Under the extreme artificial demand of peak lactation, its normal homeostatic controls are just overwhelmed. It undergoes rapid, massive, often uncontrolled fat mobilization, flowing the liver and triggering pathological hyperketonemia. It's really a system in crisis, a metabolic consequence of our own design, as you said.
Then the camel.
The camel embodies the conservation model. Its metabolism is profoundly risk-averse. During fasting, it demonstrates that tightly regulated, minimal fat mobilization. It actively defends its blood glucose levels and suppresses metabolic extremes. It's built for endurance and survival in unpredictable, harsh environments.
And the deer fits where?
And for the deer, it's the cyclical adaptation model. This is a planned, anticipatory feast and famine strategy hardwired into its biology. They build massive fat reserves in autumn, then enter a pre-programmed state of metabolic depression in winter. This involves controlled, large-scale fat mobilization, leading to that physiological ketosis as an integral survival tool. It's a finely tuned rhythm aligned with the predictable cycles of nature.
This really highlights how deeply connected their metabolic responses are to their specific evolutionary paths, doesn't it? The environment shaped the strategy.
Absolutely. The camel evolved in arid, unpredictable deserts. This naturally favored extreme metabolic efficiency, water conservation, and endurance, leading directly to its ketosis-resistant metabolism, likely involving that low BH-BDH enzyme level as a key adaptation. The deer evolved in temperate climates with highly predictable seasonal shifts in food availability. This selected for the ability to rapidly accumulate fat and then efficiently utilize it during the lean winter months, resulting in that programmed circannual metabolic rhythm with controlled ketosis. The dairy cow, however, is a different story. It has been subjected to intense, very recent artificial selection focused almost solely on maximizing milk production. This has inadvertently created a highly productive but metabolically fragile system. The natural evolutionary programming for seasonal adaptation or conservative energy use has been largely overridden or simply can't cope with the imposed demands, leading to what we can fairly call a production-induced pathology.
This is truly fascinating stuff, and it clearly has real-world implications, not just academically interesting, but useful for you, the listener, whether you're working directly with these animals or just curious about biology.
It absolutely does. The practical takeaways are quite significant. For veterinary medicine involving camelids, for instance, the message is clear. Resist the reflex to diagnose ketosis. It's highly unlikely. Instead, focus your diagnostic efforts on primary nutritional issues, especially mineral deficiencies or things like gastrointestinal parasitism or maybe ruminal acidosis if their diet changed suddenly. Giving propylene glycol, the standard ketosis treatment for cows, would be inappropriate and likely ineffective. A thorough nutritional analysis is key.
And for wildlife management.
For wildlife management involving deer and other cervids, it's absolutely crucial to accurately differentiate between late winter starvation and something like capture myopathy. That careful post-mortem examination, looking specifically at bone marrow fat content versus acute muscle damage, is what guides appropriate management decisions. Starvation points towards habitat or population density issues, while capture myopathy points towards human disturbance or handling practices.
What about farmed deer? Does this apply there too?
Yes, and in animal husbandry for farm deer, it's important to remember not to simply extrapolate dairy cow protocols. Farm deer, even if managed intensively, rarely get pathological ketosis because they haven't undergone that same extreme selection pressure for production. It's better to support their natural seasonal cycle as much as possible. Their primary metabolic risk in a farm setting is often ruminal acidosis from sudden access to high-grain diets, not ketosis. So focusing on gradual dietary transitions and ensuring adequate fiber is much more relevant.
So this deep dive really hammers home the point that ketosis is far from being a simple monolithic concept. It's actually a complex metabolic state that varies wildly depending on the species, its unique evolutionary story, and significantly whether and how humans have intervened.
Exactly. Understanding these nuanced, species-specific metabolic adaptations isn't just academic trivia. It really empowers us to make smarter, more effective decisions in animal health, in conservation, and in husbandry. And it leaves you wondering, doesn't it? What other common biological terms, things we think we understand, might hold such surprising context-dependent truths, just waiting for us to take a closer look?